Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about bone health and what exactly is osteoporosis. Osteoporosis is a bone disease. Its name comes from Latin for porous bones, meaning holes in the bone. The inside of a healthy bone has very small spaces like a honeycomb. Osteoporosis increases the size of those spaces, causing the bone to lose strength and density. In addition, the outside of the bone grows weaker and thinner. Osteoporosis can occur in people of any age, but it's more common in older adults, especially in women, but men get it too. More than 53 million people in the United States either have osteoporosis or are at high risk of developing it. It is more common in women due to hormonal shifts that occur with aging. One reason for this is the impact of falling estrogen levels after menopause. A consistent estrogen level is important for maintaining the rhythm of bone remodeling. Low testosterone in men also increases their risk for osteoporosis. Certain medical conditions and some medications can speed up the process of osteoporosis. This is called secondary osteoporosis. Steroids like cortisol and prednisone make it harder for your body to absorb calcium, and they also increase how much calcium you lose in your urine. Taking thyroid hormones can also increase your risk of bone thinning. Thyroid hormones speed up the bone remodeling process, which results in an increased risk of imbalanced bone cell growth. Abusing alcohol, smoking, and having an eating disorder and low body weight are additional risk factors for osteoporosis. These interfere with your ability to absorb necessary nutrients like calcium and vitamin D. People with osteoporosis are at high risk of fractures or bone breaks while doing routine activities such as standing or walking. The most commonly affected bones are the ribs, hips, and the bones in the wrist and spine. Early stages of osteoporosis don't cause any symptoms or warning signs. In most cases, people with osteoporosis don't even know they have the condition until they have a fracture. It's considered a silent disease because there are no telltale symptoms until a bone breaks. If symptoms do appear, some of the earliest symptoms may include receding gums, weakened grip strength, weak and brittle nails. Later signs may include loss of height, change in posture, fractures, and sudden back and neck pain. If you don't have symptoms but have a family history of osteoporosis, talking to your healthcare provider can help you assess your risk. Bone density is a way to determine if you have osteoporosis. A bone density scan is painless and takes between 10 to 15 minutes to be performed. It is an open scan where a patient lies on a table and has a scanner go over their hip and spine to determine how dense the bones are compared to those of the same age and gender. Symptoms of osteoporosis can cause pain and discomfort. It is recommended that you see a healthcare provider immediately if you are experiencing severe pain, particularly in the back, neck, hip, or wrist. You may have a fractured bone that requires evaluation and treatment. Treatment for osteoporosis includes medications to help build bone mass. The medication often have hormonal influences, stimulating or acting like estrogen in the body to encourage bone growth. It is important to take action to prevent bone loss and maintain bone density. Examples of bone-building steps you can take are engaging in regular exercise. Regular weight-bearing exercises help build bone mass, and that's key. Examples include weightlifting, dancing, jogging, or racket sports like tennis. Low-impact exercises like walking or using the elliptical machine are important to an overall healthy exercise program, but they don't provide enough bone resistance to build stronger bones. Eating enough calcium. On a daily basis, an adult needs about 1,000 milligrams of calcium per day until they're 65 years old. After that, calcium needs to increase between 1,200 and 1,500 milligrams a day. Foods that are rich in calcium include low-fat dairy products, canned sardines and salmon with bones, broccoli, beans or legumes, collard greens, kale, bok choy, fortified bread, cereal, and almond milk. Getting enough vitamin D is key. Vitamin D on a daily basis is important. Vitamin D is vital to helping the body absorb calcium. Most people need about 400 international units of vitamin D daily. About 15 minutes of sun exposure every day can stimulate vitamin D production. Foods such as fortified milk, eggs, and salmon also have vitamin D. Avoid unhealthy substances. Smoking or drinking excessive amounts of alcohol increases your risk of osteoporosis. If you have any questions or would like to find out more information on what we discussed today, please feel free to leave them in the comments section below. I'm Dr. Amy Schreibman, and this is Medical Minutes. Please don't forget to follow us on Facebook or on our website, The Boca Voice. I look forward to seeing you soon on our next Medical Minutes.